So you're using home oxygen, which is fantastic. It can be a real lifeline. But are you sure you're using it as safely as you could be? Today, we're going to break down some of the most common and frankly dangerous mistakes people make and show you how to fix them so you can use your therapy with total confidence.
All right, let's just start with a quick check-in, just for you. As we go through this list, I want you to think about your own routine at home. Could any of these slip-ups apply to you? And hey, this is a no-judgment zone, okay? This is all about making sure your therapy is doing its job and keeping you safe.
And look, let's be clear. Home oxygen is an amazing thing. It really is. It gives you freedom, it gives you support, it's quite literally a lifeline. And that's exactly why we need to get a handle on the risks, so you can enjoy all those benefits without any worries hanging over your head.
Okay, so where do we begin? Well, we've got to start with the #1 biggest danger, the one everyone needs to be aware of: fire. Seriously, understanding this risk is the absolute foundation of being safe with your oxygen at home.
Yeah, take a look at this number. It's pretty staggering, isn't it? When researchers looked into burn injuries that happened with home oxygen, they found that a whopping 87% of them, they all came down to one single thing that's completely avoidable: lighting a cigarette. It just goes to show you where the greatest danger really is.
And you know what's wild is that the rules to prevent this are so simple. For smoking, the rule is absolute. It's a hard never. Don't ever do it while using oxygen. If there are any other open flames, we're talking candles, gas stoves, fireplaces, the rule is just as clear. Keep a safe distance. You need to be at least 3 meters or about 10 feet away at all times.
But it's not just the obvious stuff like open flames, you know? A lot of everyday things we use are flammable and get even riskier when you're in an oxygen-rich space. We're talking things you might not even consider, like certain skin creams that are oil-based, or aerosol cans like hairspray. Even alcohol-based hand sanitizer. You gotta let that stuff dry completely before you do anything else. Seriously.
Okay, so we've talked about keeping your environment safe. Now let's switch gears and talk about medical safety. This brings us right to your personal prescription and why getting that flow rate exactly right is so critical.
So, first things first, let's just make sure we're all on the same page. What even is a flow rate? Well, it's pretty simple. It's a specific dose of oxygen your doctor prescribed for you. It's measured in liters per minute, and it's been carefully calculated just for your body and your needs.
So why is everyone so hung up on this specific number? Why is it so important?
I mean, it seems so simple, right? You feel a little more breathless, you might think, hey, I'll just crank it up a bit. Or maybe you want to save some oxygen, so you turn it down. But that is a really dangerous mistake.
This is probably the single most important thing to get into your head. Oxygen is a medicine. Think about it like any other prescription. You wouldn't just decide to double your dose of a heart pill, right? It's the same thing here. Too little won't help you, and believe it or not, too much can actually be harmful. And the stakes? They're really high. Changing your flow rate without your doctor telling you to can have some pretty serious results. You see, for some folks, giving yourself too much oxygen can actually make your respiratory condition worse. Yeah, worse. And if you turn it too low, you're not properly treating the lack of oxygen, the hypoxia, which is the whole reason you're on it in the first place.
All right, let's move on to the actual machine itself, the hardware. Because getting comfortable with your equipment and knowing how to take care of it is a massive part of using it safely and, well, just feeling confident with it every single day. I really wanted to pull this out as a direct quote because it is just so important. Your tubing has these little things in it called fire breaks. Think of them like little safety valves. If a fire ever gets to the tubing, they instantly cut off the oxygen supply. They are an absolutely vital safety feature, and you should never, ever take them out. Okay, here's another super simple but really crucial bit of maintenance. Cleaning your concentrator's filter. You should be doing this about once a week. It's easy. Just look at your manual to see how to pop it out, give it a good wash with some basic soap and water, and, this is key, you have to let it air dry completely. Don't rush it. Let it get bone dry before you put it back in. You know, one of the biggest dangers with home oxygen has nothing to do with breathing at all. It's tripping over the tubing. We've all been there. That long, loose tubing snaking across the floor is a classic trip hazard. The best thing to do is just make it a daily habit to check where it's lying and move it out of walkways. And hey, if it's a constant battle, don't be afraid to ask your oxygen provider about a piped-in setup that runs the tubing along the walls, keeping it safe and sound.
Whew. Okay, we've covered a lot, right? Fire safety, getting your prescription right, taking care of the equipment. Let's boil it all down into 3 simple rules you can easily remember to help you breathe safely.
If you remember nothing else from our chat today, remember these 3 golden rules. Number 1, respect the flame. No smoking, period. And keep that 3-meter safety bubble around any heat source. Number 2, trust your prescription. Oxygen is medicine, so don't mess with it. Never, ever change your flow rate yourself. And number 3, check your equipment. A quick weekly filter clean, a daily check on your tubing, and make sure those life-saving fire brakes are always in place.
So, I want to leave you with one final thought, a question for you to take away. Thinking about everything we just talked about and thinking about your own daily life, what's just one small thing you can do, starting today, to make your home oxygen routine even safer? Thanks for tuning in.